Hi, I'm Dr. Thurston. I'm one of the doctors who will be taking care of your daughter today.
Oh, hi. It's nice to meet you.
Good. How are things going?
You know, they're going all right.
Yeah, well, it sucks to be in the hospital, doesn't it? Mm-hmm. Okay, well, this is her third admission for DKA over the past 3 months. Can you tell me what's going on? How often does she check her blood glucose?
Well, to be honest, she's not really checking it much at all.
That's such a lie. I check it every night and some mornings.
Elizabeth, that is not true. You do not check it every night. You almost never check it during the day.
You're so wrong. You don't know what you're talking about.
I'm telling you the truth.
Okay. Well, what's her insulin regimen like?
I think she's on Humalog, and it's in the morning, and a sliding scale, and then at
Mom,
lunch.
You're wrong. That's what I used to do, not what I'm supposed to do now. My mom doesn't know what she's talking about.
Okay. Well, Elizabeth, since you seem to know a lot about what's going on, why don't you tell me? How often do you check your insulin regimen?
At night and sometimes in the morning.
Okay. And your mom says you're not checking it during the day. Is this because you're embarrassed at school to have to go to the nurse's office?
I'm not embarrassed.
Oh, I'm sorry. I assume that's why you would want to check it at school.
No, I just don't want to miss hanging out with my friends.
Well, you know, you only have to check it once a day. There are lots of kids who have to check it 10 times a day, even more. So that doesn't seem that hard. You have to check it once a day. Okay. Well, before you get back to your phone and texting, can you tell me what your insulin regimen is? Elizabeth, can you tell me what your insulin regimen is?
I'm too tired right now.
Hi, I'm Dr. Thurston. I'm going to be taking care of you, Elizabeth. How you doing?
Pretty good.
You good? All right. How's it been being in the hospital?
It's fine. It's the hospital.
Yeah, well, I get that. Wanted to ask you some questions. Would you like me to talk with you first or with your mom first?
You can talk to me. She won't know anything anyways.
Okay. Do you want her to stay in the room or do you want her to leave?
I don't care. She can stay, I guess.
Okay, all right. So it sounds like this is your third admission for DKA over the past 3 months. So what I'm trying to do is maybe talk with you, come up with some strategies, ask you some questions so we can figure out how to keep you out of the hospital. Okay? So maybe tell me a little bit about your blood glucose. How often do you check it?
Always at night and some mornings.
Okay.
I have to interrupt. It is not always at night. A few nights a week, maybe, but definitely not always at night.
No, she's not right. She's not telling the truth. She doesn't know what she's saying.
Okay. Well, I think it's helpful for me to ask Elizabeth the questions right now. So, Ms. Smith, would you mind maybe taking a walk, grabbing some coffee, and then once I'm done with Elizabeth, then you and I can talk about your concerns? Does that sound okay?
Sounds fine.
Okay. In a little bit. Thank you. Thanks. Elizabeth, is it okay if I have a seat?
Yeah, sure.
Great. All right. So it sounds like you and your mom are on very different pages about your blood glucose.
Yeah, she thinks I do nothing, but that's not true.
Yeah, that has to be really frustrating. Well, can you tell me what you do for your blood glucose?
I always check at night, sometimes in the morning, and I'm supposed to check it during the day at school, but I don't.
How come?
Because I don't want to miss hanging out with my friends.
Okay. I could see how that would be a problem, having to take them out. Well, are there other times during the day maybe you can check it?
I'm not sure.
Okay. Well, maybe that's something we can figure out. We can talk about some other things. How about your insulin regimen? Can you tell me what that is?
It's actually changed so much that I'm not exactly sure.
Okay. Well, changes happen, and that could make things a little bit confusing. So that's also something maybe we can talk about. All right? All right, so those are all the questions I have for you. Do you have any questions for me?
Nope.
No? Okay. All right, perfect. So I'm going to go talk with your mom. All right? It was nice to meet you.